is Kang, and I am in a group with Romel, Chelsea, Nock, and Kylie. And in this group, we are going to discuss about the impact of nocturnal shift on nurses' health and wellness. So a little overview, we are going to discuss about the literature reviews, the background, the significance, the relevance to nursing, some data findings analysis, contributions to the solution that we think should implement, future recommendations, and our references. Some background about this topic is that there are many known negative stereotypes within the nursing career regarding night shifts at medical facilities, nursing homes, hospitals, etc. Working nocturnal shifts have been linked to turn to burnouts within the nursing profession. Within the nursing profession, there are also many studies that have linked strong correlations with negative physiological and psychological effects within the long-term work.
Hi, my name is Nock, and I'll be going over the significance. Nocturnal shifts have a huge impact on nurses and the healthcare professionals. Primary negative effects include sleep disruption, fatigue, poor sleep quality and hygiene, circadian rhythm interruptions, mood alterations, interpersonal relationship disruptions, obesity, cardiovascular diseases such as heart attacks and strokes, low job satisfaction, lower tolerance for job workloads, cognitive changes, and impaired perceptual and motor abilities. According to Bell Spraster et al. 2023, a total of 450 emergency nurses responded to the questionnaire. Findings found that around 81.1% and 14% of the study participants endorsed moderate and high levels of stress, respectively. The majority of the participants had poor sleep quality, 35.3% were overweight, and 18.7% had obesity.
Our next slide is about why our topic is relevant to nursing in general. Nursing is a physically and intellectually demanding job. Healthcare demands 24-hour patient care. Therefore, nurses are required to work nocturnal shifts that can negatively impact their health. Disruptions in an individual's internal clock can result in a weakened immune system, decreased cognitive function, and cardiovascular disease. Through this research, we will better understand and possibly prevent long-term complications associated with working nocturnal shifts.
Hi, my name is Nock, and I'll be going over this article about night shift work and the risk of metabolic syndrome, findings from an 8-year hospital cohort. So this type of study is a cohort study. Participant setting includes 5,775 Taiwanese hospital workers. The purpose of the study is to investigate the association between night shift work and the risk of developing metabolic syndrome, a condition that increases the risk of cardiovascular disease, stroke, diabetes, and cognitive decline. This article was chosen due to its relevance to the effects of working the night shift on the health of nurses. The study found that night shift work is associated with a higher risk of developing metabolic syndrome and high waist circumference compared to day work. Among night shift workers, an increased number of night shifts was associated with high blood pressure. The study highlights the negative health consequences of working the night shift and the need for further research into the long-term effects of circadian rhythm disruption on metabolic disturbances.
My literature review was on the meta-analysis of nursing-related organizational and psychosocial predictors of sickness absence. This study focuses on absence rates in nurses and what risk factors influence higher rates of absences. One top contributing factor was working night shifts. This meta-analysis proved a hypothesis that working night shift negatively impacts the health of the person. This article also points out that working night shift causes disruptions to the person's internal clock. This results in a weakened immune system, decreased cognitive function, cardiovascular disease, obesity, etc. This study compiled 3 decades of research and hopes to influence preventative strategies to reduce sickness absences.
A little about my article and my study is that it is based on the impact of night shift rotations on nursing performance and patient safety. It is a cross sectional study where there are 1,256 nurses from different nationalities worked in the hospital units and have hospital work experience in the public hospitals within multiple regions of Saudi Arabia. So the purpose of this study is to explore the impact of night rotations on nurses' physiological status, work performance, and patient safety concerns among nurses in public hospitals. It is a journal from Wiley Online Library in 2021. So what we found was that there was a high proportion of nurses encounter adverse patient safety, performance, and physiological impact due to night shift work. Participants' responses indicate that they were highly concerned with the inadequacy of nursing staff involved with night shift work. This is not surprising since almost half of the participants did not like doing night shifts. The current study's findings are consistent with other studies conducted elsewhere that nurses on night shift rotations face substantial stress which might affect their performance.
My article is titled The Impact of 12-Hour Night Shifts on Nurses' Driving Safety. It is an experimental study, and there were 44 day shift nurses and 49 night shift nurses who all worked 3 consecutive 12-hour shifts. After working their 3rd shift and on their 3rd day off of work, their driving skills were tested using a driving simulator. This study aims to determine the effect of night shift nursing work hours on a person's driving abilities when driving home after 3 consecutive days of work. This article is from Nursing Reports and was done in the year 2023. My findings include, first, that night shift nurses were found to have increased lane deviation, which you can see on the right in the top graph. Also, night shift nurses were found to brake more violently, which increases the risk of driving collisions. This graph can be seen on the right on the bottom. Thirdly, night shift participants experienced collisions in 11% of drives versus 7% in day shift participants.
The study that I'm going to be talking about is the effect of night shift on sleep quality and depressive symptoms among Chinese nurses. This was a cross-sectional study, and it comprised of 174 day shift nurses and 691 night shift nurses that all agreed to participate and complete self-administered questionnaires. These participants were invited from the Junhua Municipal Central Hospital in Zhejiang Province. So the purpose of the study was to compare sleep quality and depressive symptoms between night shift and day shift nurses. The tools that they used were the Pittsburgh Sleep Quality Index and the Hospital Anxiety and Depressive Disorders Rating Scale. This journal was published in the Neuropsychiatric Disease and Treatment Journal, and it was published in the year 2019. So, based off of the chart for the results of this study, 29% of the day shift and 43% of the night shift nurses reported having depression, while only 15% of the night shift nurses reported having good sleep quality, with 31% of the day shift nurses reporting good sleep quality. So there's a significant correlation between working in the night shift and having poor sleep quality and depressive symptoms. Based off of these studies, our contribution to solution, implementation, intervention, and improvement are the following: identify health concerns associated with working nocturnal shifts, implementing strategies to reduce sick absences among nocturnal shift healthcare workers, surveying nocturnal shift workers regularly to identify health risk factors, and implementing hospital policies to promote wellness among nocturnal shift workers.
Future recommendations and next steps. We hope to bring awareness about all of the physiological and psychological challenges of the nurses working nocturnal shifts. We hope to research ways to combat all of these challenges together. Additionally, we hope that there is further research regarding nocturnal post-pandemic registered nurses working in a hospital healthcare setting. From this research, we hope that there is a transition in hospital policy to provide additional resources for all nocturnal shift workers to promote health and wellness.